This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2018. Young athletes in contact and collision sports are at high risk for shoulder injury and recurrent glenohumeral instability. The Latarjet procedure is an open or arthroscopic stabilization procedure used to treat anterior instability typically when there is a substantial glenoid bone defect or after a failed Bankert repair. Researchers in this study used retrospective chart reviews and online questionnaires to collect data from contact and collision sport athletes who underwent the open Latarjet procedure. The participants had anterior glenohumeral instability only. Those with posterior or multidirectional instability were excluded. All procedures were performed by one of two surgeons, and a deltopectoral approach was used. The average age was 26, and there were 9 females and 64 males. 41% were undergoing their first procedure, while 59% had one or more previous failed stabilizations. 78% of the participants had no postoperative instability, and of the whole cohort, 49% had a full return to their preoperative sports level. The rate of post-surgical shoulder dislocations after the Latarjet procedure was low at 8%. 72% of the participants with no previous stabilization procedure and 75% of those with one prior procedure were able to return to sport. However, for those participants with 2 or more previous stabilizations, the return to sport rate dropped to 39%. The Latarjet procedure is a viable treatment for high-risk contact or collision athletes with recurrent anterior glenohumeral instability. Compared to patients with 2 or more prior stabilization procedures, patients with 0 or 1 prior stabilization procedure are more likely to successfully return to sport after the procedure.